Welcome to HBC Benefits Guide for new retirees entering Medicare. HBCBenefitsWebinar.com with Kevin Sanders, Health Insurance Consultant. Webinar objective: educate new retirees. Provide a roadmap. Get the most from their Medicare coverage selection. Here are some unknowns retirees may encounter with their transition to Medicare. If I am turning 65 soon, what are my Medicare choices? Which Medicare plan should I enroll in? What is Medicare? What is a Medicare Advantage plan? Can I travel with my Medicare plan? Can I keep my same doctor? If I do not take Medicare Part B when first eligible, will there be a penalty later? Are my existing prescription drugs covered with Medicare? What does Medicare Part B cover? Do I have to pay a premium for Medicare Part A? Many seniors struggle with the inception process for Medicare coverage selection once they reach age 65. A common theme emerged while helping seniors with their Medicare coverage plan selection: Medicare education before coverage selection. Most retirees have healthcare coverage with their previous employer. Retirees' decision to transition to Medicare can impact their out-of-pocket cost sharing dramatically if retirees do not understand which pathway is most suitable for their individual needs. Things that retirees need to consider when selecting a Medicare Advantage plan: cost, coverage, network, care coordination, monthly plan premiums. When compared to Medicare supplement insurance plans and other health plan coverages, Medicare Advantage plans may offer lower monthly plan premiums. Some MA plans may have a $0 monthly plan premium. Predictable cost. Medicare Advantage plans have an annual out-of-pocket maximum that limits the amount of money a member must spend every year for covered services. In addition, some benefits may have a copayment, a set dollar amount which provides predictability when it comes to a member's cost share. Coverage. Additional coverage. Medicare Advantage plans must provide all the benefits covered under Medicare Part A and B, but most plans offer additional coverage beyond original Medicare. In addition, many MA plans integrate Part D prescription drug coverage, providing members with Medicare Part A, B, and D coverage all in one plan, all with one member ID card. Medical-only coverage. Some retirees may want to enroll in a MA-only PFFS plan because they want to keep their standalone prescription drug plan, PDP. Network-based plans: HMO, POS, PPO. Health Maintenance Organization, HMO. Point of Service, POS. Preferred Provider Organization, Regional Preferred Provider Organization, PPO, RPPO. Some retirees may be willing to use in-network providers to limit out-of-pocket expenses. Retirees who are interested in a plan with out-of-pocket coverage may be willing to pay more for the flexibility of using out-of-network providers for covered services. Non-network-based plans. Private Fee-for-Service plans, PFFS. Retirees may want the flexibility of using any provider that accepts Medicare and is willing to accept the plan terms and conditions of payments. In some cases, it is the only MA plan available in some rural markets. Care coordination. Some retirees may want a primary care physician, PCP, to coordinate their care. Yet other retirees may want the flexibility to see a specialist without needing a referral. Medicare Overview. Medicare is a government program that provides health insurance to certain groups of people, including people who are 65 or older and people under 65 who have certain disabilities. Medicare consists of two main parts that cover hospital stays and medical care, as well as two additional parts that provide more flexibility and prescription drug coverage. Medicare Part A, hospital insurance. Medicare Part A helps pay for hospital stays, including meals, supplies, and testing. It also covers some home health care and stays in a skilled nursing facility. Part A coverage is generally available without having to pay a monthly premium if you or your spouse paid Medicare taxes while working. If you aren't eligible for premium-free Part A, you may be able to receive Part A coverage for a monthly premium. Medicare Part B, medical insurance. Medicare Part B covers services from doctors and other healthcare providers, outpatient care, home health care, and some preventative services. Part B coverage is voluntary and requires a monthly premium. Most people pay the standard Part B premium of $135.50, monthly premium for 2019 each month. Patients must meet an annual deductible before coverage begins. Medicare Part C, Medicare Advantage. A Medicare Advantage plan is a type of health plan offered by a Medicare-approved private insurance company. Medicare Advantage plans offer all benefits and services covered under Part A and Part B, and usually include some prescription drug coverage, Part D, as well. They may include some extra benefits and services as well. Medicare Part D, prescription drug coverage. Medicare Part D helps cover the cost of prescription drugs. Part D coverage is run by Medicare-approved private insurance companies. Part D coverage may help lower the cost of your prescription drugs and help protect against higher costs in the future. Your pathway to Medicare begins here. There are two main choices for how you get your Medicare coverage. Use these steps to help you decide. Step 1. Decide if you want Original Medicare or a Medicare Advantage plan. Step 2. Decide if you want prescription drug coverage. Step 3. Decide if you want Medicare supplemental coverage. Which Medicare option retirees choose depends on their preferred use. Original Medicare. If you do not like network benefits, have chronic conditions, travel a lot, want to keep the same doctor. Medicare Advantage Plan. Like network benefits, non-chronic conditions, comfortable with doctors in the network, light travel. HBC Benefits Q&A for retirees. How do I apply for Medicare? If you plan to retire at 65, apply for Medicare through your local Social Security office up to 3 months before your 65th birthday, unless you're already receiving Social Security benefits. You may have to pay a late enrollment penalty if you delay signing up for Medicare more than 3 months after you turn 65. If you're already receiving Social Security benefits, you do not need to apply for Medicare. You will automatically be enrolled. If you or your spouse continue to work and you or your spouse are covered under a group plan, take your Medicare questions to your local Social Security office or your group benefits administrator. How do I get a Medicare card? You may contact Social Security as soon as 3 months before your 65th birthday to request your Medicare card, and there are 3 ways to do it. Go to Social Security Online Services, or visit your local Social Security office, or call Social Security at 1-800-772-1213, toll-free, or 1-800-325-0778, toll-free TTY for the hearing speech impaired, Monday through Friday, 7 a.m. to 7 p.m. How do I get Medicare Part D? Anyone receiving Medicare is eligible for Medicare Part D and can receive this optional coverage by enrolling in a Medicare Advantage plan with Part D coverage, a Medicare Cost Plan with Part D, or a standalone Medicare Prescription Drug Plan, PDP. What does Original Medicare cover? Original Medicare covers inpatient hospital care, Part A, and outpatient medical expenses, Part B. How does Original Medicare work? In most cases, you can go to any doctor, other healthcare provider, hospital, or other facility that's enrolled in Medicare and is accepting new Medicare patients. With a few exceptions, most prescriptions aren't covered in Original Medicare. How much does Medicare cost? Medicare charges a monthly premium for Medicare Part B, medical insurance. Most people will pay the standard premium amount, which may change from year to year. Medicare Part A, hospital insurance, is usually premium-free for most people. If you enroll in a Medicare fee-for-service, Medicare prescription drug plan, or a Medicare Advantage plan, you may also pay a monthly premium to the company. What do Medicare Advantage plans cover? Medicare Advantage plans, also called Part C plans, are offered by private insurers and offer more benefits and services than original Medicare. In addition to all services under Medicare Part A, hospital, and Medicare Part B, medical, many Medicare Advantage plans cover Medicare Part D prescription drug coverage, vision services, and health and wellness programs. Does Medicare cover dental, eye exams, and hearing aids? Original Medicare does not provide dental, vision, or hearing coverage. Most HBC benefits provider Medicare health plans offer those services through Medicare Advantage, an optional supplemental benefit package. What's the difference between Medicaid and Medicare? Medicare is a federal program that provides health insurance to people age 65 and over, people with end-stage renal disease, ESRD, and people under 65 with certain disabilities. Medicaid, Medi-Cal in California, is a public health program for families and individuals with low income and resources, not currently available in Maryland, Virginia, Washington, D.C. Does HBC benefits providers offer Medicare health plans? Yes, we offer affordable Medicare Advantage health plans that have earned a reputation for service and quality. See the provider plans and rates available in your area. What are the requirements to join a HBC benefits provider Medicare health plan? You must meet these 4 requirements. 1. You are entitled to Medicare Part A, hospital insurance, and enrolled in Part B, medical insurance. If you live in Maryland, Virginia, or Washington, D.C., you only have to be enrolled in Part B. 2. You reside in our HBC benefits provider's service area for the plan in which you are enrolling. 3. You enrolled during a valid enrollment period. See details on enrollment periods. 4. You do not have end-stage renal disease, ESRD. There are limited exceptions to this, such as if you are already a member of our plan in the same region in which you wish to enroll. Will I be turned down for membership in one of HBC benefits provider Medicare health plans because of my age or medical condition? Provider plan if you have had a kidney transplant and no longer require life-sustaining dialysis. No, enrollment in a HBC benefits provider Medicare health plan requires no health exam and there is no age limit. However, if you have end-stage renal disease, ESRD, and require dialysis, you are not eligible for one of our Medicare health plans unless you are currently a member of the HBC benefits provider region in which you wish to enroll and were diagnosed with ESRD while a member. You may join. If I join a HBC benefits provider Medicare health plan, will I lose my Medicare coverage? No, you do not lose Part A and Part B coverage. When you become a member of our provider plan, HBC benefit provider will provide your Medicare benefits to you. You must maintain your Part B Medicare enrollment in order to keep your coverage in a Medicare health plan. What does a HBC benefits provider Medicare health plan cost? HBC benefits providers offers Medicare health plans with a $0 premium option in some areas. In other areas, you might pay monthly premiums and co-payments for the services you receive from a HBC benefits provider. If I work past age 65, when should I sign up for a Medicare health plan and how? You can sign up for a provider Medicare health plan as soon as you're ready to retire. Enroll over the phone at 866-422-0363. And one of our licensed HBC Benefits Medicare Health Plan consultants will make sure you're all set. I am a current HBC Benefits Provider member. Can I stay with HBC Benefits Provider after I start getting Medicare? Yes, you can continue your HBC Benefits Provider membership and use the Medicare benefits you're qualified for by joining a provider Medicare health plan once you are eligible. Can my spouse join a HBC Benefits Provider Medicare health plan too? Yes, as long as your spouse is eligible for Medicare. How do I enroll in a HBC Benefits Provider Medicare health plan? You can easily enroll over the phone. You may also download the enrollment form, complete it, and mail it to us. Or call 1-866-422-2363 toll-free, 8 a.m. to 8 p.m., 7 days a week, and our licensed consultants will be happy to help you. How do I enroll in Medicare Advantage plan? You can enroll in a Medicare Advantage or Medicare Advantage with Part D at the same time you enroll. Can I make changes to my application after I submit? Yes. Contact HBC Benefits at 1-866-422-2363 toll-free, 8 a.m. to 8 p.m., 7 days a week. We will be happy to help you. How can I check my enrollment status? You can check your enrollment status by calling 1-866-422-2363 toll-free, 8 a.m. to 8 p.m., 7 days a week. Thank you for attending today's HBC Benefits webinar guide for new retirees entering Medicare.